I wanted to talk about top surgery and how it was for me. Um, and I guess I always thought that top surgery videos were sort of like, I don't know, you've seen one, you've seen them all. But I definitely was like watching a lot of them after surgery, trying to like see like, is this normal? Do other people experience this? What other people go through? So I think that's valuable, and I want to share my own experience in case it helps somebody. Um, So I got surgery from Dr. Scott Mosser in San Francisco, and I got paid for it through my school insurance, which is pretty dope. And I live nearby, so I drove up the day before surgery with my partners and stayed in a hotel. And then my surgery was at 7:30 a.m. the next morning, so we got to the hospital around 6. And I went through like the admissions process, and I went up to the come and go unit, and a nurse took me in, and my partners had to stay in the waiting room, and I changed into a gown, and she took my blood pressure, and I signed some things, and she asked me questions, and then she put an IV in my arm of just saline solution, and then my partners could come in, and so they stayed with me in that little, like, it was like a hospital room with like a curtain. So they stayed with me for the next like 45 minutes before surgery, and during that 45 minutes, the surgeon came by and drew all the incision marks in my chest and answered any final questions I had, which I had a lot of because I'm uh, just an anxious baby. And then the anesthesiologist came in and told me what to expect and gave me like something like Valium apparently to help me chill out a bit before the surgery. And then I think the nurse came in who was going to be in the operating room and asked me like the same questions as everybody else. But then it was time, and I had only slept like 3 hours the night before because I just like couldn't sleep. I was too excited. So I felt a little loopy, but they were about to put me under anyway, so whatever. So then a nurse rolled me into the like operating room, and my partners waited to go by, and they were gonna wait for me in the waiting room. They'll meet me in the recovery room, and then it was so weird. I've never been like on an operating table before, like it's weird to see. I've seen it in like TV shows and stuff, but to see it from the perspective of like being on the table is pretty wild. So yeah, there's just like 5 people in the room, all suited up and masked up, and all doing things. And they just started immediately. Like one person was like putting compression things on my legs to prevent blood clots, and the other person was like moving my arms around, and then someone else put an oxygen mask on my face. So they were joking about how like they're all just coming at me at once, and they all seemed really nice. And before they put me out, I asked if I could just say something, and so they took the mask off, and I just said like, I just want to thank you all for doing this, and they were like, oh, you're so welcome. Oh, and another cool thing was that some of the nurses were referring to me with he pronouns, and I use they them pronouns. So my surgeon, Dr. Mosser, always corrected anybody whenever that happened. Like, and the nurses were trying to like do the right thing, but they shouldn't know. So somebody would be like, make sure you move his leg this way, and Dr. Mosser would be like, no, neutral pronouns, they them, and that was cool. So yeah, then they put me under, and I woke up in the recovery room. I had a very nice recovery room nurse named Robert, who gave me ice chips and ginger ale. My partners came in, and I was really chill and content, because last time I got surgery was for my wisdom teeth, and when I woke up from anesthesia from that, I was like really, I was like crying and shaking. But this time it was just like, ooh, so chill. So yeah, I woke up really slowly. Robert would come by every couple minutes to give me more ice chips or just check in on me. And then I think after probably an hour and a half, I was awake enough that they wheeled me back to the little curtained area that I was in before. And then the nurse came in and went over, like, how to take care of me after surgery. Like, this is how you lift them up out of bed. You put your arms behind their shoulders and, like, pull them up. And this is, like, how you adjust the pillows underneath their arms. And, like, blah, blah, blah. So all sorts of things. And then they put me in a wheel. Oh, and then I got the nurse and my partners helped me get dressed into like this kind of comfy clothing and the button-up shirt and everything. And then they put me in a wheelchair, and they wheeled me down to the front door. And somebody from the hospital had gone and gotten our car and brought it to like the loading area. And they helped me into the car, and we walked to the hotel. So that was surgery, and it went really well. That wasn't the part that I was really worried for. And like, since I started the process of top surgery, which takes like 6 months at least, because you have to like find a surgeon that you want to go to, make a consultation, which can be anywhere from like a couple days to a couple months later, have the consultation, set up the surgery date, which again can be anywhere from a couple months to like a year later, and then like get insurance stuff dealt with and blah blah blah. So I was originally going to go to Dr. Satterwhite, but he wasn't able to see me till next fall, I think, and my school health insurance runs out in the summer, so I needed it to be before then. And then I talked to a doctor named Dr. Delgado, Miguel Delgado, and also in San Francisco, but he said something during the consultation that made me like be like, I don't want to get surgery from you. He was like asking me all those questions about my gender, and like it felt like he was interrogating me about my gender, and then he's like, okay, well, I just want you to be sure because, and I'd sent him pictures of my topless chest because it was a virtual consultation, so he needed to like see what my chest looked like, and so he said, I just want you to be sure because you have such a beautiful chest, and it'd be a shame to like lose that. So I was like, gross. Not going under anesthesia near you. Yeah. So, but then I tried Dr. Mosser, and I've heard a lot of good things. My therapist says I should send people to him, and I like the look of his results online. And he was super friendly on the phone over the virtual consultation, and didn't say anything that made me feel uncomfortable. So yeah, I had a consultation with him just like a couple days after I set it up on the phone, which was cool. And then I think I set up the surgery in October, and I set it up for January, so it's only like 4 months out rather than like 8 months or more. And then over the next couple months, I just dealt with all the insurance stuff as it came up. Got my therapist letter, all that jazz. And it was so hard. The closer it got, the harder it was to wait. And the closer it got, and the harder it was to wait, the more I was just like, I wasn't ever really nervous about my decision to do it, which is funny because before I like started the process, I was really unsure. But like, I just was just like, yeah, it's time. Let's go. Let's get these things off me. And the closer I got, the more dysphoric I felt because the harder it was to handle having boobs and all that. So let's see. So yeah, closer it got, harder it was to wait. The last night was torture. I barely slept. I had a lot of anxiety in the weeks beforehand about getting sick before surgery and having to push it forward, especially because everybody around me was getting sick. But like somehow I managed to avoid that, which is amazing because usually I do pick up other people's colds. But that's just like every night it was just this like running anxiety train of like, what if this, blah blah blah. And there's nothing I could do about it. So, but I didn't get sick. I didn't get sick before, during, or after, which is fucking wild. I mean, there's still surgery recovery to go, but I think I could handle a cold at this point. Like, knock on wood, doesn't happen, but still. Yeah, so okay, that's pre and during, pre and op. For post-op, it's been 5 days, I think. Thursday, Friday, Saturday, Sunday, Monday, Tuesday. 6 days. And the first day we spent in the hotel, well, Thursday we spent in the hotel, the day of the surgery. And I mostly slept via my pain meds and anesthesia and stuff. And my partners got me all propped up in bed with pillows, and they got me like yogurt and applesauce and soft food like that. So that was nice and easy. I didn't really feel much pain. I didn't feel bored. I just was sleepy. I just felt happy. I was just like smiling, just like happy to, felt good. Then on Friday we came home. The drive home was pretty hard because every little jolt was painful. So I took a second pain pill on the drive home, and then I basically napped the rest of the way home, and that was okay. And then, yeah, basically the next few days were exactly the same. I lay in bed, swaddled, surrounded by pillows, with like my like 3DS and my laptop, and my phone, and the chargers for them all in reach, and just like stayed there. So I got up and like moved to the couch to like watch a TV show with my partners. And during the first couple of days, just getting up and sitting back down was like really hard. Like, it didn't hurt a lot, but it like took the energy out of me, and it was like difficult to maneuver. I also felt very nervous about fucking anything up by like moving too much or in a certain way. And like as the days have gone on, I've gotten a little bit less nervous about that. I'm trying to be very, very gentle, but like I don't know. I would stop if it hurt, and what I'm doing doesn't hurt, and I'm not like reorganizing the house. I'm just like making myself eggs and like picking up my clothes or something, you know. So yeah, I think the recovery this past week has been mostly good. Honestly, the worst parts were this binder that it got put on me after surgery that I had to keep on the whole time. It just like it digs into my armpits, and that was like really painful for a while, and it constricts my breathing. Like it's hard for me to talk this long because it's just like I can't get that much breath into my body. And it's so tight that like my back hurts and it's hard to find a comfortable position to sit in, and I had to sleep propped up, which wasn't that hard when I was on pain meds because those kind of knocked me out. But I stopped taking them yesterday for a reason I'll talk about in a second, and last night I like didn't sleep until I just like couldn't fall asleep, took a Benadryl, made me feel really fucked up instead of helping, and then I just stayed till 6 a.m. rather than like lie in bed and hallucinate. So yeah, so the binder was one of the worst parts. The incisions really didn't hurt that much. Every time it started to hurt, I just took another pain med every like 4 hours, and I only took 2 pain meds like 3 or 4 times. Other than that, I just took 1 every 4 hours or so, sometimes longer. And every time it started to hurt a little bit, and that would knock it out. And right now, I haven't taken anything except for a Tylenol last night. I think around like midnight, and it's now like 2 or 3 actually, and I just haven't needed it. So, but yeah. So the other worst thing. Oh, hold on a second. Yeah.
Hey, West.
Hey, Riley.
Let me ask you about your poop.
Oh, thank you for asking. I was actually just about to talk about my poop, so like, how helpful.
Cool. I'm glad.
Yeah.
What a coincidence.
I know.
That we didn't arrange ahead of time.
Nope.
Cool.
Such a goober. I can cut this out. So, what's up?
I want to hear about your poop.
Oh, okay. You want to hear about poop? Sorry. So yeah, the worst part was my binder. The second worst part is that I did not poop from surgery until today. I pooped today, Riley.
Good. I'm so proud of you.
So proud of me too.
It's been like 4 days, huh?
Yeah. Thursday, Friday, Saturday, Sunday, Monday. 5 days.
Tuesday. 5 days. Yeah.
Yeah. And that was the fucking worst because like my guts just felt all bloated and taut and awful, and I didn't want to like eat more while like I wasn't pooping because like I was just so backed up. And they told me that pain meds would do that, and they gave me a prescription for stool softeners. The stool softeners didn't do shit, and I wish that I'd taken a laxative much sooner than I did. Because on like the 5th day, or the 4th day, I took some milk of magnesia, but it didn't do it. So this morning I took the full dose, 4 tablespoons, I'm pretty sure, of milk of magnesia yesterday in the morning. And then today I took another 4 tablespoons in the morning. And then I finally pooped. And it was like, thank God. Thank God.
Yay!
Yeah! My bowel movements! I'll be regular again. Yeah, so they don't tell you, or I don't know. I didn't see it often in most of like top surgery stuff that I read, but just like I would say, get yourself some laxatives before surgery, and don't be afraid to use them, because it would be better. I would have rather pooped a lot than not at all. Yeah, so now that I'm a day, so I think yesterday is when it started getting really hard to wear this thing 24/7 and be like stuck in bed and like have a hard time moving around. The other thing about this binder is that like it makes like sitting up straight really hard when I'm standing. I end up like crouched over like a gremlin whenever I'm doing anything, and then I'm like, why am I doing this? And I like straighten up a bit, but like it just sort of like makes me hunch because it's just so tight on my chest. So God, I'm so fucking excited to get this thing off tomorrow. And I know I have to wear it for 3 weeks. Or maybe more. I don't know what Dr. Mosser's recommendation is going to be. But at least I can take it off for showers. Starting tomorrow. So yeah, this week, this 1 week post-op thing has been pretty exhausting. I've been very lucky to have a lot of good support people around me, who are willing to like take care of me and hand me things I can't reach and bring me food and tuck me in and spend time with me and stuff. And on the whole, I haven't been too like bored, but especially because I'm not taking the pain meds anymore because I just don't want to be constipated anymore and I don't need them anymore. Um, it's hard for me to sleep with the binder on and sitting upright and stuff, and I can't just like nap through it, which is basically what I've been doing for the past 5 days. It's just like 4 hours, like fall asleep. So yeah, that's been my experience so far. I have been feeling very anxious about what my scars and nipples will look like tomorrow, but I've been doing the best I can, without just like completely lying still. And whatever happens, happens, and it'll be okay. I think there's anything else. Oh yeah, another thing is that sometimes I've been hiccuping or burping, and like really makes me nervous about like whatever the fuck it's doing to my chest. But I think it's fine because this is really tight, and like the incisions are taped, the nipples are taped. I don't think that hiccuping is going to affect anything. But I was like furiously googling like burping after top surgery on Google at like 4 in the morning without finding anything. So I'm sure that people have had that experience. No, I guess that's it. Thanks for listening.